Hello, my name is Eben De Matteo. I'm the physician assistant with Dr. Frank Noyes. On behalf of our team here at Cincinnati Sports Medicine, I'd like to welcome you to our Total Knee Replacement educational series. In this video, we'll be discussing the post-operative or discharge phase of your knee replacement.
After your procedure, if you are admitted to Jewish Hospital, you'll have several sessions with physical therapy. They'll assist you in beginning the rehab process, teaching you how to safely use your walker, transition between different positions, as well as possibly begin gentle range of motion. A member of our surgical staff will be by to see you the next morning. At this time, we may assess the surgical site or change your dressing if needed, though it's likely that your first dressing change will be conducted at your first outpatient physical therapy visit. While the staff is with you at that time, they'll assess if any changes need to be made to medication or if further labs need to be conducted before you're safely discharged home. After this, we'll begin preparations for the discharge process so that you could be smoothly transitioned home.
Jewish Hospital has a program called Meds to Beds. This allows you to fill your prescription at our in-house pharmacy so that you can avoid making an extra stop on your way home. When preparing to go home, be mindful of the vehicle that you'll be utilizing for transportation. You may need more room for comfort or assistance getting in and out of your vehicle. Also, be sure that you have someone staying with you when you go home, as you'll need help with daily activities due to your restrictions in movement.
There are several things that you can do while at home to help reduce your pain and swelling. The first of these is ice. Ice can be applied to the knee for about 20 minutes every 1 to 2 hours. Be sure when you're using ice to keep a barrier such as a towel or a pillowcase between the ice itself and your skin to help prevent any thermal injury. Elevation is also recommended, as this helps us use gravity to our advantage to pull swelling from the lower extremity back towards the core. You should be utilizing your compression stockings that were given to you at your preoperative visit. These help prevent blood clots and utilize this compression to help push swelling back up towards the core. And remember, it's important to move. Every once in a while, be sure you're getting up, stretching your legs, walking around, and be sure you're always doing your ankle pumps. After a knee replacement, patients are usually on an opioid pain medication for the next 3 to 4 weeks after surgery. The plan we utilize to control your pain will be unique to you. These medications are prescribed on a week-by-week basis. This allows our team to interact with you and ensure that we are utilizing the most appropriate medication and dose to control your pain and keep it at a tolerable level. For additional pain control, you may be able to take Tylenol, also known as acetaminophen, in between your doses of your opioid pain medication. It's important to note, however, that most opioid pain medications already have Tylenol or acetaminophen in them. Because the liver works so hard to filter Tylenol out of the bloodstream, it's important that a patient does not take more than 3,000 milligrams of Tylenol in a 24-hour period. This can be easily done by documenting the amount of Tylenol that you are taking between the over-the-counter Tylenol and the Tylenol that is already in the opioid itself. Be sure to speak with a member of our team if you're having any issues with pain control or adverse side effects from your medication. The most common side effect from opiates is constipation, so be sure you have a laxative or other remedies at home to counteract this issue.
As discussed in our last video, after surgery you're at an increased risk of blood clots. It's important that you know the signs and symptoms for a blood clot in the calf or a deep vein thrombosis, as well as a blood clot in the lung or a pulmonary embolism. Several of these signs and symptoms are listed on the page that you see here, and it's important that you notify your treatment team as soon as possible if you exhibit any of these. Another possible complication after surgery is infection. Please know the signs and symptoms on this page as well and notify us if you exhibit them as soon as possible.
For some patients, a total knee replacement requires Dr. Noyes to balance out their ligaments to ensure that they have a stable knee after surgery. All total knee patients should speak with Dr. Noyes or a member of our team if you're planning on having any procedures by a specialist such as those listed below. You may require an antibiotic prior to this procedure, as you could have some bleeding that would allow bacteria to enter the bloodstream and travel to your knee, causing a prosthetic joint infection. That is the last thing that you want.
Patients are not typically driving until approximately 4 to 6 weeks after surgery. While driving, you cannot be taking any narcotic pain medication, and the definitive date of when you will be allowed to drive should be discussed and determined by you, your physical therapist, and your surgeon.
In conclusion, be sure to see your primary care provider 30 days before your surgery and get your pre-op labs done early. This will allow us to correct any abnormalities prior to the procedure. Prepare your home for when you're discharged to minimize the risk of any injury or accident. Make sure to utilize the HIPAA cleansed soap 5 days prior to your procedure in order to decrease the risk of bacterial infection. Follow the strict instructions for your diet prior to the surgery. Bring the assistive device such as a walker or crutches with you to the hospital, as well as an accurate list of your medications including the name, dose, and frequency. Remember that getting up and walking after surgery is key to an expedient recovery, and if you are admitted, you're typically discharged 1 to 2 days after your surgery. We greatly appreciate the opportunity to be the orthopedic team that you've chosen for your total knee replacement. Please don't hesitate to ask us if you have any questions about the information that you've seen in this video series, or any questions that you have about your total knee replacement.
Thank you for taking the time to watch this video. Please be sure to ask us any questions you may have so that we can be sure to make your knee replacement a smooth and enjoyable experience.